Hi, I'm Dr. Pradeep R, Consultant-Neurologist and Epileptologist. Today, I'll be briefly talking about epilepsy. Epilepsy is a disorder of brain which manifests as repeated seizures. Usually, these seizures occur due to excessive electrical activity in the brain. Worldwide, around 50 million people are affected with epilepsy. In India, roughly around 12 million people are affected with epilepsy. Some of the most common causes of epilepsy are due to brain tumors, stroke, infections, congenital syndromes, or maybe because of during birth and because of decreased oxygen supply to the brain. So epilepsy can present with various manifestations. They can have shaking of legs or hands. They can have confusion episodes. They can have just staring episode. Also, or else they can have lip smacking episodes. There are many precipitating factors for epilepsy. Some of the most common precipitating factors are missing medications, lack of sleep, flashes of light, and in females can be because of menstruation. So the most important thing is persons with epilepsy should not miss their medications. Their compliance to the medication should be very good, and whenever like they should have adequate sleep like 7 to 8 hours per day. So whenever you come across a patient with epilepsy, make sure like whenever you witness an episode of epilepsy, you make sure that persons don't get injured, so that their surroundings should be injury free, and try to record whatever event is possible, so that whenever the patient is shifted to the hospital, it will be easy for the doctors to witness the event, because whenever you see that event you will be very nervous, so you will not be able to know what are the sequence of events. So this will help the doctors to recognize what is the type of event, and also helps them in their management. So it is a myth that epilepsy will get controlled by giving keys, or maybe like smelling some onions, or sometimes they do like smell their slippers, or by keeping some metal objects. It is a myth. Usually what happens most of the time, the seizures usually get stopped by 1 or 2 minutes, and very rarely gets prolonged more than 5 minutes. So usually if it is more than 5 minutes, make sure the patient is shifted to the nearby hospital, so that whatever required emergency things will be done at the hospital. Most of the times most of the patients with epilepsy are well controlled with medications. Very rarely patients with epilepsy will not get controlled. Usually 30% of people will not get controlled with medications. So those people with this type of drug refractory epilepsy can be evaluated further for surgeries.